will we be able to see all the folks as they arrive?
I have that.
Okay.
And then just a reminder that this session is being recorded. Eliza, we've got about 2 minutes, but maybe we'll wait an extra couple.
Sure. Gina, we need some nice background jazz music, some elevator music.
We do. I'm not that that well trained, but next year.
Yeah.
Okay. It is 8 o'clock and we have a few guests. Welcome. Eliza, do you want to wait another minute or so?
You know, we have actually a lot to get through. So I just the beginning, you know, as people kind of trickle in, that's okay. I think it's fine. And I can certainly, you know, go back and, you know, repeat anything we said in terms of like the history or where we're at in terms of marijuana legalization. So we could just go ahead and get started and catch people up as they come in the room.
Okay, well, great. Well, good morning to everyone and welcome to this morning's presentation. Eliza Muse from the Office of Substance Misuse and Addiction Prevention will provide this morning's presentation. Eliza has been with the Division of Public Health since 2011. She started in the prevention world in the Tobacco Prevention and Control Program, then moved in 2017 into the Marijuana Education Program, which she built. The program uses evidence-based strategies to develop public health interventions to minimize marijuana-related adverse health consequences in Alaska. Eliza, thank you for being with us today. And if you haven't already, please share your name, role, and organization in the chat. And with that, Eliza, you are on.
Great. Thanks so much. Well, we have two folks in the room today along with Gina. So Maria and Vanessa, welcome. And Vanessa, you're with the Department of Education. Oh, great, cool. I feel like I've definitely seen your name before just because the last name Salmon is just so perfectly applicable here to Alaska. And welcome Maria and at Benny Benson. Well, we'll go ahead and get started here. So the title of our presentation, we originally were going to include alcohol sales data into this presentation just because at the time of the emergency disaster declaration, both alcohol and marijuana stores were deemed as essential, which kind of changed how they deliver products to Alaskans. And then locally, depending on where you were at, you know, whether, you know, you had curbside delivery or things like that, or, you know, even delivery here. in Anchorage. And so but what we found is when we took a look at the data, it was really hard to parse out, because we also know during the pandemic, restaurants were closed and a majority of alcohol sales kind of happened through restaurants. And so the data we got were sales data, just across the board, broken out by wine, beer, and liquor. And it was really hard to understand where the impacts of restaurant closures, as it relates to the alcohol sales. So ultimately we ended up, taking the alcohol sales piece out of this presentation. So we'll be talking about pandemic marijuana sales and implications for public health. So just to ground us in where we're at, legalization in Alaska and language. So as a program, we don't use the term recreational use. And that's really because there's a lot of reasons why Alaskans may use, and instead we opt for the terms retail use or adult use, because this marketplace was open for adults only, and you purchase your products through a retail source. Of course, there's still an illicit marketplace that we know, existed before the marketplace, but in this context, because we're really looking at sales, we call it adult or retail use. Alaska's also had a really long history with decriminalization efforts, which kind of mirrored national drug control policy over the last 40 years. And then in 2014, our marketplace opened up. We do use the terms cannabis and marijuana interchangeably, but I do want to recognize that the term marijuana use is actually deeply steeped in anti-immigration efforts throughout the country. And with the 1937 Marijuana Tax Act, which is really tied closely to anti-immigration efforts. And so some people intentionally choose not to use the term marijuana because of that kind of not so great history with that term. But here in Alaska, we kind of use those terms interchangeably. What we've done in our focus groups is that testing is that marijuana is actually the most commonly recognized term, with cannabis a close second. So we'll just use both those terms here today. It looks like we've got more folks joining us, so welcome. So with the legalization here in Alaska, that means that we have an increasing product diversity here in the marijuana marketplace. So if we just kind of scroll through the next series of slides, just giving us a sense of what is for sale here in Alaska. So, and we've got vaping products, dabs, dab rigs, concentrates, all sorts of edibles. And sometimes it's really hard to know what's what and what's marijuana and what isn't. I think vaping is a good example of that. We have a mode of delivery, which is vaping, that you can refill with all sorts of, your e-juice and things like that, which might be vape, might be THC. It's hard to know. So next slide. So along with the increasing product diversity, we have with the marketplace, we have growing potency, so increase in potency. So this slide kind of shows average THC and CBD potency of traditional and concentrated marijuana from 1995 to 2018. The dark green line is the average THC of concentrated marijuana. And 60.95%. We actually know here in Alaska that there are products sold that can reach up to 99% THC in those concentrates. So this is a slide from the University of Mississippi that actually gets federal funds to track and trace and test marijuana. But we know even this slide is not reflective of the Alaska's marketplace. The bright orange line is flower, so just traditional marijuana products. And CBD is included in here because there are cannabidiols. There are all sorts of tetrahydrocannabinoids and cannabidiols in plant-based or concentrated marijuana. But really for CBD, if you reach a 0.3% or higher in your products, if you are part of an industrial hemp program, you're not able to sell your product. So really the point with CBD is to keep it low. If you want it, to be able to sell it at, as part of an industrial hemp program. So next slide. So I thought it might be a nice time to put it to you here in the chat box and I can do this, Gina. So what are some of the health implications for adults and youth who use cannabis Oh, great. Thanks, Gina. So what we're talking about here are daily.
We're almost there.
What we're talking about here is regular use or daily or near daily use. So what are some of these health implications of regular use among adult and youth heavy use? Well, that's okay, because we've got a couple other questions in the chat. So I know it's early and we're just getting started here. So we can move on to the next slide and talk a little bit about the science. So there's 4 major reports that guide our program planning and kind of the information that we put out here as a state health department. The World Health Organization report, the National Academies of Sciences report, and there's 4 comprehensive reports that have come out of Colorado that are statutorily mandated to really study and monitor health concerns related to marijuana. So those are kind of our foundational research that we use here. And what those reports show, and they're all association only, so we don't have any sort of clinical trial work or any sort of individual research that's been conducted. These are all association only because of the federal status of marijuana right now still as a controlled substance makes it really hard to do research on. So these data are association only. And what we see are dependence of, so if we'll just go back to the last slide. So there is a stronger evidence for dependence and addiction, especially when you start early and use heavily. There's evidence of low birth weight for pregnant moms. As it relates to injury prevention and control, there's strong evidence of increased accidental ingestion. So we saw with marketplaces opening up that, especially in Colorado and in Washington, and those early adopters, that emergency room and poison control calls did go up. Also motor vehicle crash, especially with when used in combination with alcohol, those 2 health effects are, they potentiate each other, and it's actually an exponential increase. And for mental health outcomes, we actually see a strong risk, increased risk with those especially with a family history of schizophrenia or other sort of mental health challenges, where early marijuana use and heavy marijuana use may unmask schizophrenia earlier in those predisposition to have it as a family condition. So, and then for those who smoke the marijuana, increased risk of respiratory effects. As it relates to youth cannabis, we know that adolescence is such a crucial period of brain development. Those neural pathways are just firing and developing, and use during this time can really disrupt those pathways as they're being developed. And that's can affect learning problems, memory, poor academic performance. We also see that especially heavy use is associated with later dependence or addiction of cannabis. And again, those mental health challenges. We do see in the data that there is an association between suicide ideation, attempt, and past 30-day use. And then coordination, judgment, alertness. So really one of our messages too is not driving after you've consumed. It's a harm reduction approach, but also not driving with someone who has also used marijuana because of the reaction time and just the dangers associated with driving and cannabis use. So it seems like a really long time ago, but it was just over a year ago that we had a vaping outbreak. We called it EVALI, so the e-cigarette vaping and lung injury outbreak. And it was where it really it was associated with primarily products purchased off the marketplace in states. But there were some outbreaks that happened with individuals who purchased licit or legal vaping products through a regulated marketplace. That I'm aware of, we had one case here in Alaska. It was a young adult, and they had some pretty serious lung injury associated with vaping THC. And so we did have across the country, 68 deaths in 29 states and in the District of Columbia. And the take home here is really know your source, but I think the bigger take home here is that science is lagging behind policy. So we have a lot of products that on the marketplace that are not harmless, and that we just don't have all the information or science about what the short and long-term health outcomes are associated with using the wide variety of products that we have available on Alaska's marketplace. So next slide. And this also underscores this challenge with marijuana, is that these health effects are just so difficult to tease out. We have a wide array of products available on the marketplace, and we don't know we can't say one-to-one that these are, correlated or even sometimes associated, because of the mode of use is so wide, and there's such a variety and diversity in the marketplace. And also the frequency of someone's use might look different. What is, using 14 days in the past 30 days really mean? Is that like taking a hit off of a vape or an all day long bong session? Like, we just don't have a good sense of, and our surveillance systems aren't always that in tune to the different types and frequency and the nuance of a person's behavior as it relates to consuming marijuana. There's also a strong overlap with other substances. So we know people who might use marijuana might use alcohol at the same time, or also smoke tobacco, or use other drugs. And there's also this strong overlap with other social determinants. So these external factors, living, income, living in an overcrowded housing, being exposed to other sort of smoke or trauma or drug use in the home. These all have real implications as it relates to our health and Alaskans' health. And they're just really hard to tease out. So we'll go into a little bit of the data just to kind of ground us in where we're at. We use the Youth Risk Behavior Survey and the Adult Behavioral Risk Factor Surveillance System. And the next series of slides just kind of talk about current use. So really what we've seen, so we can move on. So current use in Alaska remained relatively flat. It's stable over time, no major increase or decrease. And we put lines in here really to show when the marketplace opened, when legal marijuana possession passed, when the marketplace opened up, and really no change over time, which might be a larger problem than we really think, because we've seen such precipitous declines in other substance misuse for marijuana to remain flat. Maybe that is a problem, and maybe that isn't something that we should be celebrating. Next slide. We broke it out by gender. I think, is this the same slide? Oh geez, sorry guys. Let's move on to the next slide. So this heavy marijuana use. So this is really, we care a lot about heavy marijuana use because of those associations with addiction and dependence, and really around the brain development piece. And again, here really showing that heavy use has remained relatively flat, with kind of something funky that maybe happened with females in 2015. But if you look at this broadly over time, no major increase or decrease in heavy use. And what this looks like in adults, we have been seeing increases across adults between 2015 and 2018. The confidence lines are kind of hard to see there, those long skinny black lines within each of these bars. And if they overlap, then that means there was no significant increase or decrease. But what we're just generally observing here is that there is an increase, in the young adult population, and actually also in the 65 and older population as well. So let's move on to the heart of the topic today, the pandemic emergency regulations. So along with the disaster declaration that was signed in March 11th by our governor, it allowed cannabis marketplaces to remain open. It allowed a lot of businesses, it deemed a lot of businesses as essential and allowed them to remain open, grocery stores, and market and cannabis stores, and and several other types of industries, of course, that are essential. And with that, the Alcohol and Marijuana Control Office adopted emergency regulations. So they adopted 2 emergency regulations that we've listed in the administrative code on the source box in the bottom left-hand corner, if you're interested in looking these up, which allowed for exterior window or drive-through pickup or curbside pickup, allowed for online or telephone sales. So you could call up your store and say, hey, do you have any of that X, Y, or Z, and purchase your products. You could also do that online, and also allowed a little bit less restriction in how marijuana is transported, really for local, more communities off the road system around marine and air transport. These emergency regulations were not intended to become permanent. So after they were signed March 11th, the disaster declaration was extended a few times and has since expired on February 14th. But throughout this period, this is kind of the new policy landscape for how you purchase marijuana during this time. And we'll see with the regulators kind of what happens with those emergency regulations. Right now, they're no longer in effect because they are tied to the disaster declaration. But this is a great slide because it really shows, well, it tells us a lot of things. So these are the cannabis sales revenues. So we have a data use agreement with our Alcohol and Marijuana Control Office to access the market sales data. And this has just been such an informative tool for our program, really, to track and see the movement of marijuana sales here across the state. This is for any licensed retail store that sells marijuana. They are mandated to put their sales and track their sales in a system called Metric, the marijuana tracking system. And these are statewide sales, so we can't right now get any more granular than month and number of sales statewide. And we know we have over 224 licenses across the state. So a lot of information going into the system, but this is kind of where we're at in terms of sales. And this shows this like steady ramping up of this industry too over time, which is to be expected. We have no cap on the amount of licenses that a retailer or a community could have. At a community level, they can choose to cap the number of licenses, but statewide, you can just keep approving licenses and sales might still happen. But I think the idea is that the market might get saturated. So that's kind of the idea there with not capping the number of licenses here. So anyways, steady ramping up, but really when you look at 2020, and we can go to the next slide, we saw a real, it doesn't look as large of an increase here, right? Because we've spread it out across the last year, but this is 2020. So our stay-at-home order or our pandemic emergency declaration signed in March. And then we saw this like pretty steep increase up to this summer, July, where we peaked out at around 26 million in sales. And then, a little bit of a dip and then, a little kind of step back up in December. So these are the sales. And I guess we'll kind of get into a little bit of a discussion here to talk about what we think might have caused, or might be associated or contributed to these sales. So we can go to the next slide. So, feel free to add in the chat box too. So what sort of factors, both individual, so we've listed a few here, but I'd love to hear what your thoughts are, or external factors might have contributed to increase in sales. Lack of other social things to do. Yep, we're home. We're stuck at home. I really liked, Gina and I were talking about this a little bit on Monday, and, as she mentioned, increased responsibilities at home. And I thought that was a really good, so the kind of falling under this idea of coping, maybe you lost your job and you're coping with financial hardship, and this, might help you address the anxiety or just coping with that. Social isolation. So certainly that might, be a factor. I think really as it relates to the environmental factors, these policy regulations were really meant to limit the number of people going into the stores. So keeping your bubbles small, maintaining 6 feet distance. So these also, but in doing so, you facilitated easier access. So drive up windows. So people who might have experienced mobility challenges, who need to stay in their car, can now drive through, or the retail store can bring the product out to you in your car. This also meant for people who have small children who otherwise couldn't bring kids in because that's not allowed. You have to be 21 or over to step foot into a store. Could have brought the product out to your car. Also, maybe people who were purchasing on the illicit marketplace or the not legal marketplace switched to the legal marketplace just because they wanted to keep their bubbles small, not really interfacing with their regular source of their product. And then this one is really interesting around employer policies. Did employer policies change as we moved the model of work from our workplace to our home? So, working from home might have contributed to an increase in sales and perhaps use during this period during the workday.
Eliza, there are a couple of comments. We have from Kelly, it seems like use among youth is even much higher because my students aren't using legal marijuana. Maria said boredom. And Jordan said, or people nervous to buy pot in a store due to social stigmas felt more emboldened to buy it through a drive-through window, less visibility now, easier to access.
Yeah, thanks, Gina. Yeah, I think all of these certainly very relevant. I wonder with Kelly's question around aren't using legal marijuana, how do you know that? I'd be so curious how we know, it's such a good point. And I think that really gets to the heart of these questions around where are kids getting these products? Like what are the points of access here? So no worries, but I really think that's a really good point. And I just would love to know, how do we know these? How do we know that? So, and then, really with the discussion, I think understanding these policies, but also who these people are that might be driving these sales. So when we looked back at that graph of the steady ramping up of the industry, we don't know who these people are. These are statewide sales data. So we don't have information about, are these new users to the marketplace? Are these people that are like, oh, I don't want to step foot in the store, but now that I can drive through, I want to go, try that thing that I wanted to try. Or, okay, yeah, thanks, Kelly. So their parents, family, and friends grow it. So we do have we have the ability to grow up to 4 plants here in the state of Alaska. So that's really, really interesting. And so, but yeah, so who are these people? Are they new, or are they just established users that are using more, purchasing more? We don't know that. What kind of products are individuals purchasing? So are they just purchasing really high ticket items, so high cost items, or are these sales really being driven by low cost, products? So, and again, these are all data we really want to have, and we're really bringing our hands over how we might be able to access some of these data around. Less about the who, because that's hard, but the what type of products are these Alaskans purchasing, and why do we care? So why do we care about this? Because I think we can really tailor the message to the types of products or to the types of experience that these Alaskans are facing during this time that might have contributed to the increase in sales. So this is, I think that's like, why do we use this data? How are we using this data? Why do we care? And I think we care a lot here in public health, and and I think it's just really important to really know the nuance of these behaviors and how these policies might interplay, because we know that the policy role is really so important here. But we, our section of Women's, Children, Family Health here within the Division of Public Health had the foresight, the great, and that were tapped into their experience and skills of being great of collecting public health data. And so they put together a series of surveys to really understand how behaviors and how mental health might have changed, increased or decreased, during the pandemic. And so we're going to really focus in on survey 4, which was a follow-up survey conducted November and December it's an online-based survey. And a link was distributed by email, website, and text. And it was a convenient sample, but the survey 4, we had about 7,000, a little over 7,000 responses here. So let's take a look at those. What we found, there was a question around alcohol and drug consumption. And what we did find is that of those surveyed, so 1,732 said that their marijuana use increased during the pandemic. So 31% indicated that they were using more marijuana than before the pandemic. And really, when you look across the substances, there was an increase in all these substances. But I think for the purpose of today, we're just really focused in on marijuana. But I do want to recognize, though, that these are all interrelated, I think. And if we move to the next slide, might be linked to mental health. So, I mean, we can't isolate mental health from substance misuse or substance use. And especially in the young adult population, so 18 to 24, had mentioned that their emotional health worsened during the pandemic, feeling more anxious, sad, depressed, more irritable, are easily angered than usual. Really, remarkable across all age groups, but we really see that in the young adult population. And so the next slide, the survey, their conclusions were that during the pandemic, many Alaskans reported worsening mental health and experienced an increase in alcohol and drug consumption, and with a heightened burden for younger populations. So, we can discuss in the chat. So taken together, what do these series of data points tell us? We've got this market sales data, but we've got those sales data, but we don't really know the who, the what. We have this other, series of data points really talking about this increased mental health burden during the pandemic and that people are using more. What do these data points tell us? Does anyone have any sort of thoughts about, I keep thinking about preparation for what's next. Throughout this public health response to the pandemic, thinking about what are we learning about ourselves and about our communities and about our state to prepare so that we can better prepare for the next one. And certainly we're still in this pandemic, even in the absence of a disaster declaration, but
Eliza,
yeah.
Kelly asks, do you have any data that support people self-medicating with marijuana who already have mental health issues and choose either to go off their prescribed medication and to choose marijuana instead? I hear that from my students all the time.
And I second that. I second that. I hear that from students like, oh, I have anxiety or I'm on these medications. And so instead of taking that, I want to use marijuana because it helps me focus. It helps me calm down.
They like it better.
I would love to see any data on that. Kelly, and I'm in an alternative school, but
yeah, we both.
Yeah. And so, but we hear that all the time.
And they like it. They tell me all the time they choose to do that. They like it better because they feel like the prescription medications, they don't like the side effects, or they feel they're underwater all the time, or whatever it is, weight gain, whatever it is. So I hear that all the time that, oh, marijuana is so much better and it works better for me, or it helps. A lot of students say it helps them sleep, who of course have high ACEs in trauma, can't sleep. They choose to use it for insomnia. And I was starting to type another thing too, that I see too, a lot of students, I know there's always this debate about whether marijuana is a gateway drug. And definitely in my population, students who have serious mental health issues and high ACEs, I really do see it. It becomes a gateway drug for them. And I was curious if you have data on that at all either.
Wow. Thanks for
and similar here too, Eliza. And I, you know, for us, we always talk to students about, to us, alcohol seems to be the gateway drug, right? They tend to have tried alcohol prior to trying marijuana. And we have really extensive, such as Kelly, like drugs and alcohol are a big part of our conversations with our at-risk kids. And so a lot of them do talk about, they tried alcohol first, and then they'll go into marijuana, and then stronger drugs, right? Prescription drugs is really big amongst our population. And so I'm just wondering, you know, I think we see these trends, like I would love to see some data around that. And I know you guys use like the YRBS and all that. And I'm just wondering if there's any discussions about adding more of that, more of these questions to that for us to be able to have clear data as we work with our students. Because that's what all this stuff brings up to me is how do I use this to help my students? That's kind of where I'm at.
Absolutely. Well, thank you. I think that's such great points. I think as part of the first question around substitution, so substituting marijuana for my other, you know, prescription drugs, we don't have that for the youth population. For adults, we have like, how are you using it? And there's, again, these are the challenges we face, I think, with a federally controlled substance is really getting the richness of these data. But we ask medical use, non-medical use, you know, and so between those. And then we have asked here in Alaska, we did a follow-up survey to that to say, are you substituting for other prescription medications? And we did find, especially for pain, that older adults were substituting marijuana for an opioid or to address a pain that they might have. But again, we don't have those for youth. But I will say about the gateway drug hypothesis, you know, we in the early research we've seen, again, we're not looking at concentrated marijuana or really heavy use. So this just daily, near daily use of an average potency product, so not concentrates, which is like are alarming. And I think we really need to study those more, is that we do see an association. So again, it's not a clinical trial or one-to-one individual research, but we see an association with later use of alcohol, marijuana, and in some cases other drugs, but the literature isn't as robust on the other drugs piece. So we see that especially there is a strong association with alcohol use and marijuana dependence in later life. The other drug piece is a little bit limited, but I think that body of research is growing. We also know with tobacco too, tobacco use early on kind of primes the brain. A lot of people talk about priming the brain. So your pathways, your neuro receptors are developing and your pathways of your brain are developing. And so if you kind of disrupt the development of those pathways, you're essentially kind of rewiring the brain to some degree. We've got some resources around brain development and youth. And so on our website, and I'm happy to share the link again for parents and adults. And it's really, I mean, these conversations you're talking about that you have with the kids that you work with are so important, that you guys are the trusted messenger, that you guys are having these conversations, that you guys are, that your kids feel, you know, comfortable coming to you because you are a trusted resource in their school and in their community for them. So these resources we provided here in this link are for parents and for teachers and how to talk to youth about marijuana and really talk about what we've learned in our focus groups with youth and parents is that they wanted more about the brain science. They wanted more to know more about what is this going to do to my brain right now. They cared a little bit less about the social and the long-term impacts, but I think that's really important here too, as we talk about back to the first point around substitution of marijuana for their prescription drugs. Certainly there's probably a reason, you know, I don't think anyone wants to dispute the way it makes them feel because they know how it makes them feel at that moment and at that time. But I think one thing, and whether or not it resonates with the youth are not, is that there are societal consequences related to possessing marijuana and using marijuana. That includes referrals to the Division of Juvenile Justice that were, or perhaps if you were, interested in going to college and you might lose your financial aid or get kicked off your sports team. Or, maybe you have a really close relationship with your grandma or your mom and they would be really upset. So there's these sort of societal, consequences that I think are just really important when we're talking still about an illegal substance. And, that goes for alcohol too.
Do you have any stuff about like the age of choosing to use being younger and younger? Because the other thing I'm seeing too is most of my students will say, the chronic users, and I'm talking about kids, it's the first thing they do when they wake up, but they started experimenting like in upper elementary. And many of them too, like I hear what Maria's saying about alcohol, but in the last 5 years or so, a lot of my students will say, their parents have had severe, alcoholism, and they've seen the effects of that. So they're like, I don't want to touch alcohol, but marijuana is fine and it's natural. And they think they're making a better choice by choosing marijuana over alcohol because they've seen the effects of alcohol in their family members. And so I've really seen that trend lately a lot in the last 5 years.
Yeah, I mean, I think we hear that a lot is, someone doesn't smoke a joint and then beat up their mom, but, or beat up their dad. But with alcohol, we see that. And so that is, it's an experience that, I think many of Alaskans have had. And I think that's really important to realize that idea and that notion. And so that's just really a good point. But I will say, as it relates to coordination reaction time, certainly does slow down. And so the driving piece is also really important too there around coordination reaction time. And I want to be mindful of our time. We've got 1 minute left, and boy, this was so great. Thank you. I mean, I think we had a small group here, but like such great questions and such great engagement. And boy, you guys are doing amazing work in a really challenging time. So great. Kudos to you all. And please reach out if you want more information or resources. And Pat, thank you so much for talking a little bit more about the YRBS data and what we might have available to us to be able to utilize for program planning. And yeah, thank you so much.
Okay, Eliza, thank you for presenting at the School Health and Wellness Institute and for providing this incredibly timely information. Thank you to everyone in the room for joining us today and sharing your experiences. That is really important. And as Pat said, there's a new question. If you are interested in developing new questions for the 2023 survey, certainly keep in touch with Eliza because we turn to our subject matter experts as we start developing the YRBS questionnaires. This is a reminder that evaluation surveys will be sent after the conference and links to the next sessions are in the chat box in a moment. Now, and we hope that you have a great rest of your conference. Does anybody have any final notes or questions?
Sorry, I have a question for Eliza. Eliza, I know that a couple years back, I heard somebody from your department, I can't remember who, talking about that there's potential for the use of marijuana money to go into rehab centers here in Anchorage or around Alaska. And I know that I always ask because I still don't see the buildings, and I'm just wondering if that's still something that that your department's working on. I know. I see a need for it, right? Many of my students are not growing up with their biological parents due to drug use. And so I'm just wondering where we are with that. And I also want to say thank you for all of the commercials and all the prevention stuff that you guys are doing. I think the marketing and all that piece. You guys are doing a great job with that. So I we've seen the growth, and so I appreciate that. So I don't want to offend you by asking where are the buildings, but I kind of just want to know where we are with that.
Certainly. So I work alongside our opioids prevention office too, which also thinks about this as well. And, we get a very small portion of marijuana sales tax to fund a variety of efforts, really more focused on what are the impacts of legalization having on Alaskans' health, and also with a focus on supporting after school programs right now. Treatment is certainly a need. I right now with the marijuana funds, it's such a small dollar amount, we wouldn't be able to support staffing or, construction projects. We could certainly support a piece of staffing, certainly. I know within school-based health centers, we're supporting some staffing to do some screening in the schools and referral to treatment. But as far as the adult population, I think that is definitely an area of need. I know in Anchorage, the plan is to use some CARES Act funding and some other funds to support a new treatment facility for adults. And so certainly I think maybe in Anchorage or other states that have local sales taxes, those sales taxes might go to support some rehab facilities in your community, but I don't quite have an understanding of that full landscape of where those local sales tax are going. But I will tell you that the state right now is really focused on just building up this program, surveillance evaluation, and then a large focus on supporting after school programs with marijuana dollars. I think with the opioids work, it's a lot bigger than that, I think. But I can certainly try to get a better pulse on what might be happening in that regards, and certainly is a need.
Great. Well, thank you so much. And
thank
Pat,
you. I'm so sorry I have to host another session, so I have to close this session out, but Eliza's information is there. I have a note to Kelly. Anybody can contact me if you would like to look at some of the YRBS measures that are available. I'd be glad to go through that. Pat, thank you very much for managing the technical chat, and I look forward to seeing you all soon this fall.
Yeah.
Thank you.
Thanks, Eliza.
Thank you.
Thanks, Gina.
Bye.
Bye.